let's say you're walking or standing for any length of time, your back is painful. And when you simply sit down, the pain goes down very quickly. That's another good sign. This stretch is going to be helpful. You do it either on the floor with carpet is more comfortable. You can do it on the bed, and that works as well. I like the floor better, but some people are unable to do that. We'll show you two options.
So in Rick's books and programs, it's called Rocking on All Fours. You may know it as a prayer stretch or the child's pose in yoga. So what I'm going to do is be on all fours like this. Personally, I like to bring my feet together when I do this. I'm going to sit my butt towards my heel, and I'm going to keep my arms in the same place they were when I started. If you don't feel much of a stretch, you can certainly crawl your fingers forward like this. You're going to hold this for 3 to 4 breaths, 30 seconds, whatever feels good for you. And then you're going to come back up. Now, say you have one side that's more problematic than the other, like say you have back pain on one side, you can certainly stretch and reach over. So if I had pain on my left side of my back, this can help open up that area more if you have stenosis.
Good. All right, now, if you do not feel comfortable getting on your knees, maybe you have a knee replacement or whatever it may be, we'll show you how to do it in the seated position. All right, same stretch, seated position. If you have a chair with rollers on it or wheels that rolls nicely, you take that chair up to a countertop or a table, hands on the table. You're gonna push the chair slowly out. And right now I'm stretching very much, almost identical to in the low back as Mike was doing. There we go. And I can tell you this feels very good. I'm going to hang out for a little bit. If I want to stretch the right side more, my right hand goes over the top of my left, and I can clearly feel the right side of my low back stretch more. You're going to hold it for 2 to 3 breaths, come back up. Do this while you're relaxed. Repeat it a few times in a row.
Is if you have one-sided back pain or possibly even a herniated disc, we're going to say I'm having one-sided back pain on my left side here. What I'm going to do is go up to a door frame. Brad's going to show an alternative option if you can't reach up this high. You could also use a pull-up bar if you happen to have one at home or at the gym. So I'm going to face the palm away from my body, grasp the top of the door frame, and then I'm going to slowly lean into the side, going into the door frame itself. This will help open up the lateral aspect of your vertebrae, decompressing that pinched nerve you may be having. You can hold this for 30 seconds and then come out.